All right. Good afternoon. So we're going to commence, and then our colleagues from the Department of Fisheries, Forestry, and the Environment will hopefully be able to join us. But I'm glad to see everybody here. So I also have a lot of students joining us today. There's only one that was removed because they have to join with their names. Otherwise, we don't know who else was joining. Okay, this is actually the first of the webinars for 2022. So I'm really excited this afternoon to be bringing this to you. As you know, we are Pharma Connect. I'm here at Tshwane University of Technology, and we bring this to you once every 2 weeks. So today we want to talk about pharmaceutical pollutants. What are they? Who do they affect? What should we be doing? And by way of introduction, this is something that actually was shared on one of the groups. This is from 2 days ago. So pharmaceuticals in rivers threaten world health. And what they find is pretty much everything: caffeine, epilepsy, diabetes, of course, paracetamol, and of course, nicotine. And some of the most polluted rivers are in Pakistan, Bolivia, Ethiopia. But remember that you only see what you want to see and where you want to see it. So we have not really done a lot of studies in Southern Africa. I know that a few years ago, there was quite a lot of work done in Hattiesburg Dam, just outside Pretoria. And then the focus was mostly on hormones. But as you know, antibiotics in the water are also not very good. And some of these things are what's driving antimicrobial resistance. Unfortunately, everything ends up in water. We have over 14,500 compounds, which we use for human health. So as medicines and also for animal health. And these give us over 10,000 tons being delivered or being put into the environment every year. A lot of them will end up in soil. Eventually, they end up in water and they affect whatever grows in water. I must tell you that I'm a pharmacist with over 25 years experience, but I don't think twice, or until this topic came, I didn't think twice of throwing things into the bin. So I have actually been a very bad person, but I'm probably not the only one. So this afternoon in this webinar, which is kind of in a way co-hosted by SAPRA, because it was an idea out of our colleagues there, and then Department of Forestry, Fisheries and the Environment. So we will talk then about this issue. Just to tell you that you can also subscribe to our channel. So we have a channel and it's got a lot of content, very useful, from cannabis to neglected foods to vaccine manufacture, standardization of herbal products. This afternoon, this will be our speaking panel, and I'd like to thank them in advance. It might be that International Federation of Pharmaceutical Manufacturers might not make it. I was still trying to understand how far they are. But I'm glad that we also have pharmacists represented here. I see people who've worked in Botswana, in Lesotho, and they will then at the end, you know, with a 2-3 minute summary, tell us what's happening in their country and what gaps exist. Just to tell you about future events. So today we are here. Next week, we are talking herbal. So we actually have people who've written monographs for the African herbal pharmacopoeia coming through. And next week, we'll focus on alloferox. Try to see, understand the plant, understand where the market of that plant is moving to and what opportunities there are. Then there's a new scramble for Africa, and that is for Africa's genes and how they can actually inform pharmacogenomics and new medicines. So we're going to have a talk around that. Also, what does it mean for regulators? Are they ready for that? And in fact, we've got a really interesting panel there with somebody from University of Texas. And then we'll go back and focus on impepo helichrysum for that. And also talk about radiopharmaceuticals. Cancer is becoming a big issue in Africa, and yet we are not really producing or training people around the radiopharmaceutical value chain, including regulation, the use of radiopharmaceuticals as medicines, therapeutics, and also in terms of diagnostics. And then something really exciting is happening. We actually have an extraction facility that's going to be commissioning at the CSIR, and this is a TUT CSIR project. Hopefully in another week, this humongous piece of equipment is going to be shipping from India into the country. And we hope that it will really assist entrepreneurs in the area of herbal pharmaceuticals and specifically cannabis. We are always happy to get new topics. That's why you'll see that some of the dates are blank. So if you have a topic that you'd like us to address, we can look for speakers and we can talk to that topic. And then we have courses that are coming up. So last year we had a very successful design thinking course. And as a result, we will be repeating it. We'll give you dates soon. We've had courses around registration of herbal products. Last year, we had a very good course on biosimilar manufacturing regulation with our friends at ICGEB, and we are now planning a second iteration of that course. And then we've had someone come and say, hey, they can train people on writing protocols for clinical trial applications. So that's something to look forward to. With colleagues at University of Eastern Finland, we are also looking at setting up a toxicology for regulators course. And when we say regulators, we really mean anybody who works with medicines, whether within the regulatory agency or outside. So these courses are very good, very interesting. And you can always send Nano there an email at nano@pharmaconnect.co.za. Okay, so Ms. Noluzuko Kwai is then going to give us an overview on this area and also on the international protocols that we actually are signatories to. She's a senior policy advisor at the Department of Forestry, Fisheries, and the Environment in South Africa. So thank you very much, and over to you, Noluzuko.